It is Thursday, May 6th. Onerahtohkó, Joe Delaron Ujets. Welcome to the COVID-19 Task Force Weekly Update. This is our 208th episode. On today's program, Lisa Westaway and Lloyd Phillips will be here with the update. Even though it's a weekly update, doesn't mean there's less work going on, that's for sure. There's plenty to report on. But before we do that, we'd like to welcome from the Kahnawake Fire Brigade. She's a very well-known paramedic in Kahnawake. Let's welcome Kateri Oesterreich.
Sengo Kahnawake, and welcome me to presenting to you guys and to the community on behalf of the Kahnawake Fire Brigade. It's an honor to actually be here and be able to speak to the community on a whole and look at some of the things that we experience as paramedics within the community and serving you as the community. What we really want to acknowledge and say is thank you, Nyawagua, to the community as a whole, because it has been an amazing job that you have been doing to help keep us all safe. And as paramedics, we see that difference in regards to when we go to your homes, you're wearing your masks, you're asking us what you need to do to help keep us safe when we're going into your homes. And we really do appreciate that effort. With that said, what we do have to remind the community about is the importance of not coming to the Kahnawake Fire Brigade for service. Understanding that, yes, there is an ambulance on call 24 hours a day. However, there are times where that ambulance crew is not present in the building. And the reality is if you come to that building and we're not there, it's going to delay getting you the service that you need. So it's a reminder to all of the community that for your care and for the safety of our community and to our paramedics, that you please call the peacekeepers at 450-632-6505, yes, for emergency services, and let them know that you need an ambulance and that's what you need. You'll also notice that over the last few months, the phone service at the fire hall has changed, requiring you to push 0 if it's an emergency. So you will be connected directly to the peacekeepers in an emergency situation. This way we can get you the service you need. We know where your location is. As well, know your ELM address, your emergency location address for emergency situations like this, because it helps us find you. Although many of us know where most people live in our community, the reality is with the expansion of our community, the small farm roads, we can't always know where your house is situated. So that ELM address is essential, in particular at this time when we're trying to limit the interaction and the number of members showing up on scene to help and assist in those emergency situations. Our COVID rules that have been in place since the onset really are about protecting ourselves and protecting you. So no one is permitted inside the Kahnawake Fire Brigade, right down to our own membership. So what does that mean for us? Well, the reality is we no longer get to have the interaction and the family that we had prior to COVID. So when there is an emergency situation, we are limiting ourselves and the people who respond. And with that, we ask that you respect that as well, that you don't come to the fire hall to just ask for services. Give us a call. We will make arrangements to meet your needs, or call again the peacekeepers for emergency services for such things. There's so many different things that go on at the hall in regards to providing service, but it's all about keeping safe. And that's what we really want to stress here today, is the importance of keeping our community and our employees safe. The reality that we face is the number of paramedics we have on staff are limited, and we need to ensure that for the safety of everyone, that illness does not get into the brigade. So masking, hand sanitizing when we arrive on scene are all really important, and that's why limiting your presence at the brigade itself in the building is essential. If there's ever any hesitation and you're not sure about your medical needs, you can always call Info Santé at 811, and they can give you some direction as to what's the best thing for you, what's the best care that you can take at that time. You can call the fire hall, and we can assist you if that's necessary. But if you have chest pain, difficulty breathing, or you're feeling in some capacity that's not normal for you, you need to call immediately. I understand that there's some fear in regards to going to hospitals and going to Anna LaBerge, but we know that the risk is mitigated in the services and how it's performed at the hospital. They separate you, they ensure that you're safe, people are masked. If you don't call when you need that, it makes the situation more critical when we do arrive. I would much rather arrive on scene to a stable person who's having chest pain than an unstable person who we need to do bigger and stronger interventions at that time. So again, anytime you're having a medical problem, don't hesitate to call the ambulance or services because of fear of COVID. Understand that your life is more important than that fear, and that we can help protect you when we get you to that hospital. One of the things that we really wanted to stress with you is understanding that as paramedics and first responders in the community, the majority of our employees and staff have been vaccinated, understanding that it's important for us to protect ourselves and our families. And with that said, we want the community to understand that we're doing what we can to help you stay safe. So we want to be sure that you understand that we will be here to help you and support you, and do not hesitate outreaching when you need care. Last but not least, it's really important that we stress mental health. As first responders and frontline workers, over the course of the last 13, 14 months, we have seen a lot of things, and we have not had the opportunity to do debriefings and interactions that we would normally do to help even us as frontline workers and our mental health. We understand where you're coming from as a community and how hard it is to not be able to be together, but we're all in this struggling together, and our mental health and exhaustion is catching up to us. So please be patient with us as we be patient with you. And if you need anything, understand that we're always a phone call away. With that said, Kahnawake.
Very well done, Kateri. Joining us now with her update is the Executive Director of the Kateri Memorial Hospital Centre, Lisa Westaway.
Thanks. I'd just like to provide a few updates regarding cases in the community today. As of today, or as of May 5th, actually, I don't know what date it is today. Is it May 5th? 6th. Okay, so this is as of yesterday. Sorry about that. We're going to show the first table, which is a total number of cases. So I don't see it up there, but I'll we have 15 active cases in the community. There are a couple that have recovered in the last day or so. So we're still at 15. And in fact, this is an increase of 15 cases since April 27th. So there are a couple of small errors on this chart that we're going to fix before we post. The first is that there are 15 new cases and not 5 since April 27th. And where you see 2 hospitalizations, actually those are older hospitalizations, and both those cases are community members who are now recovered. So they are not hospitalized at this time. I don't want to give any false information. So we currently have 15 active cases, and we've separated this chart into 3 waves. So the first wave, we did have 22 cases. The second wave started in September 2020, and there were 86 cases. And the third wave began March 28th. And since that third wave has started, we've had 24 cases. So quite a lot of cases recently. However, we're going to look at the age breakdown, because this is something we've been talking about for the last couple of weeks, the changes that have happened over time and as a result of vaccination. So if we go to the next chart, we're going to look at the positive cases by age. And as you can see here, our highest number of cases are in the 10 to 19 year group. There are 24 cases there. And again, there are an increase of 15 cases since April 27th. Under 29, there are 10 new cases over the last couple of weeks. Over 30, 5 new cases. So double the amount of new cases for the younger age population. This is very expected, only because, well, for several reasons. Number one, much of our elder population has been vaccinated, and therefore there is less of a risk of transmission. They are more protected, which was always our goal. Also, because we know that times are very, very difficult for youth right now, and have been for a long time, because their lives, as all of our lives, but their lives have been severely disrupted, and so it's normal that they're trying to find outlets for during the developmental stages that they're in. So we are asking community organizations, families, and youth to, if they do gather, to do so with as many protective measures as possible, meaning wear your mask, keep your distance, try to be outdoors, even though, of course, gathering is not permitted. But in the cases where these measures are not followed. We ask that you still keep safety measures as much as possible, because we still have a significant amount of community members who are at risk, who are not actually vaccinated, and therefore we need to continue to protect that population as well. So the increase in cases is expected. We're also seeing in Quebec this age category has a significant increase, again because they're not vaccinated, and we do see some outbreaks in schools, in the cities around us, or in workplaces, so people under 29. We still, in our schools here in Kahnawake, have multiple safety measures in place. We have bubbles, we have a very limited amount of students in the schools, and a significant amount of children that are still online learning, and therefore we still are in a safe place in the community. It doesn't mean that there's no risk. There is risk everywhere because COVID does exist, we know that, but we try to mitigate risk as much as possible to decrease the possibility of transmission. What's really positive and what shows that our measures are working in the schools is that even though we have had classroom closures for individual cases, there has not been transmission to others through the school classrooms. So this is really important and demonstrates that the measures we have in place are doing what they're supposed to do. Public health as well as KEC are doing their job to limit transmission of the virus within the classrooms, even if there are positive cases. Something that was announced yesterday by Health Canada, I wanted to touch upon it, is that the Pfizer vaccine was approved for 12 to 15-year-olds. Many people have started calling KMHC asking when, or the task force asking when vaccinations will take place for this age group. This is a very, very new development. We are working with regional public health, with the ministry, to look at the possibility of vaccinating 12 to 15-year-olds. However, we are not there yet. And there is still some discussion being had about this age group in general being vaccinated versus this age group and those who have serious complications. And so we're waiting for a bit more clarification regarding that. However, we are working towards getting vaccines for this age group in the near future, and definitely before school would restart in September. As you know, we put out a release yesterday for vaccinations for 16 and 17-year-olds. The vaccinations will take place next Thursday and Friday at the bingo hall. So we ask that you make your appointment through Kahnawake 911. Click on the link for Click Santé, and there are spots available for you to be able to book your appointment, and this will be with the Pfizer vaccine. We are also doing providing second doses to anybody who received Pfizer as a first dose from KMHC, KFB, PKs, and KSCS, and that is also taking place next week. So that's the next phase of our vaccination campaign. All of our workers from those 4 organizations will have had their second dose, and we'll be looking at other essential service workers after that, as well as the general community members who have not yet had their second dose. I may have mentioned last week we're waiting on an announcement from Quebec regarding a change in the interval between first and second dose. We still have not received that information, but we do expect a decrease in that delay between first and second dose, and we should have that shortly. Another mention regarding vaccination, the KMHC pharmacy will be starting their vaccination campaign sometime next week, so I'll have more details for you soon. However, if you are interested in receiving a first dose, not a second dose of Moderna, you can contact the pharmacy because they are already starting to create their lists. Again, you can also call public safety to leave your name and number if you do want a first dose, because we do accumulate those names and we make arrangements to vaccinate individuals on that list as quickly as we can. Testing. So at the testing site, one little change, well, it's actually a big change that I wanted to discuss with you, and it's part of our moving forward plan for prevention and for self-determination, really, for you to be able to make decisions for your health and well-being moving forward. And that's that you can, if you are nervous about possibly having COVID or having been in contact with someone or of having been in a location where you think there might have been COVID, you can contact the testing site at KMHC to be screened, and that's if you don't, even if you don't have any of the symptoms related to COVID. So as we move forward in possible reopening measures in the coming weeks or months, it's important that we have the ability to identify cases quickly, because COVID still exists and there still is always going to be a risk. And so one method that we're implementing at the testing site is to be able to test somebody who is worried for themselves or a family member to come in, even if you don't have symptoms. However, we still cannot test or screen people who are crossing the border for school or for travel, and for that purpose you have to follow the usual measures that the border control provides to you. One thing that we do ask when you do call the testing site is that you have your Medicare card handy, because it's important for us to have that Medicare card when we book your appointment at the testing site. If you don't have a Medicare card or it's not up to date, that's okay. You can still call, but if you do have a Medicare card, we ask that you have it with you when you do call. Lastly, Mother's Day, I'm going to go back to vaccines actually. One thing I wanted to mention, because we do get a lot of questions, is about interchangeability of vaccines, meaning getting Pfizer as a first dose and Moderna as a second, or vice versa. So as you know, it's widely in the media right now that that the Programme d'Immunisation du Québec, the PIC, has approved the interchangeability of mRNA vaccines. Therefore, the Pfizer and the Moderna, they state, are interchangeable. However, it has also been stated that this can only or should only be done in the context where an individual cannot remember what their first dose was. So they either received it from another country, they no longer have their slip, there's no way of determining or identifying what the first dose was. In those circumstances, we can vaccinate with a different vaccine, and the 2 doses will still be approved and eligible to provide immunity. However, this is not something that we are implementing here in Kahnawake. So I want to make that clear. Your second dose will be the same as your first dose. And so I don't want to deter anybody from being vaccinated, and so we are being sure to maintain the same dose for dose 1 and dose 2 here in Kahnawake. Last thing, this Sunday is Mother's Day, so just a reminder to think of all your moms, reach out, phone call, and at KMHC we are having a Mother's Day drop-off. Well, we have drop-off this Sunday anyways, but it is a special day for Mother's Day, so we will have extra staff on hand to be able to handle the influx of gifts that may come in for your moms. So that's it. Thank you.
All right, thank you very much, Lisa. And last but certainly not least is the Commissioner of Public Safety, Lloyd Phillips.
Thank you, Joe. A lot of information there, Lisa. Thank you, as well as Kateri. Thank you for that update from Kahnawake Fire Brigade and explaining to the community some of the, I guess, the impacts on the paramedics over at KFB and the tough job and the great job he's been doing, since the beginning of the pandemic. I have a few points I want to touch on this afternoon. A couple of quickly, because Lisa did mention about the border. We have been getting many inquiries in the past week regarding what is required at the border and what are the rules at the border, and according to the task force. We have put out some previous information on that regarding, there are a few exemptions that are granted for people who are students or cross-border workers or people who have received a a screening, so prior to coming back to the community, and there could be some exemptions from isolation. However, what we have to stress, and is extremely important, that what the requirements are at the border. When you cross the international border between U.S. and Canada, the task force, we have no say or no authority on what we may impose upon you in terms of what measures you have to take, what tests you have to do, how to get that test done. That is totally within the realm of the Canada Border Agency, and we have no say over that. So whatever they impose upon you, unfortunately, we have no input, no say on how that rolls out. So you are bound by those rules. So I just wanted to make that clear, because we did get a number of inquiries in the past week. Again, because things are evolving as things move forward, but border restrictions remain in place at least until May 21st, and after that, I guess Canada and the U.S. will jointly decide whether or not they're going to increase or extend the border closure at that time. Changing topics now, just talk about obviously 15 cases, as Lisa just mentioned, in the community, which is still very significant. It's near the higher end of cases we had at one point throughout the pandemic. It is concerning, and it is important that people understand that we still need to, again, we have said it many times, remain vigilant, remain safe, and follow all the safety measures in place. And we understand that some of these, the rules of the game sort of changed, in the past several weeks since March, when the variants have become more dominant in and around the community. So isolation rules have changed. Some masking recommendations have changed. And so we have to be careful. Because, like was said, COVID is still here, and it will be here for some time to come. But despite this, and looking at everything and considering everything that's going on and the length of the pandemic, we are still working very cautiously on what the next steps could be in terms of reopenings and taking the next steps to relieve measures in the community. We're watching closely many factors. What's happening in and around the community. We're watching with great interest what Quebec is considering, but we also look at Kahnawake specifically. And considering the fact that we have approximately 75% of our community vaccinated with at least one dose, and the fact that Quebec has significantly increased the rate of vaccinations, to their population, so that gives us a little bit more comfort and moving forward. Mind you, there's certainly no absolutes, but we have been putting together a phased approach, and we're looking at meeting with Dr. Fuller tomorrow to present some concepts and some ideas, with the intent of presenting some recommendations to the task force next Wednesday on what phase 1 could look like. So I wanted to relay that information because I know a lot of people have been asking, is things going to change, and when is the status quo going to change and such? But we are working diligently towards that goal. Again, but we also have to remain careful. So after next week's task force meeting, there may be some announcements on steps moving forward. But we have to also remember, no matter how or what measures are adopted or changed, there is risk. And the more measures are reduced, the more things that open, there is definitely that increased risk. More movement, more contacts equals more risk. So we have to try to have a balanced approach. And considering that there's also the mental health aspects in the community, a lot of stress and anxiety out there, there's also major economic impacts in the community. So we're trying to find a balance in where we could take a first step and be as safe as possible. But then again, community members as a whole, it'd be on you as individuals to decide whether or not you wanna accept additional risk and by doing certain activities within the community. So what our goal and our intent and moving forward is gradually to look at reducing measures, continue with the education of the community, but then again, putting the ball back in your court, so to speak, where decisions will be lying with individuals on whether or not they want to partake in certain activities in the community. Mind you, it'll be gradual, and there is no set timeline at this point, but it would certainly be 2 to 3 weeks before various phases roll out in the community. Again, watching very closely what's happening in Kahnawake, and if need be, we'll have to push the pause button on any future relieving of measures. But our ultimate goal is to continue on that path towards normalcy, allowing for more freedoms, allowing for people to see their families better, look at economic impacts and such. So small steps, baby steps at times. So next week, I'm looking forward to having some more information for you, but I want to rest assured the community that all these things that we've been hearing from industry, from businesses, and from community have not fallen on deaf ears, and we're looking at them in a very real way, but a really safe way as well. Kahnawake.
Thank you very much, Lloyd. And once again, we before we leave, just to mention that we talk about the younger people now, the age group from 10 to 19 seems to be the group that's being hit hardest, and they're also the group that's hardest to reach in terms of getting these messages out there. So adults, parents, uncles, aunts, grandparents, talk to your kids, your family, and remind them that the work that is being done is very important for all of us. So with that, just one quick note, I forgot to mention this. The updates, as you know, the updates here on Kahnawake and 911 are being done now on Thursdays unless there's a need for more. We'll always do extra versions, episodes if we need to. But on K1037, they're only going to be doing their updates on Monday morning, right after the 8:30 news. They had been doing them on Mondays and Thursdays. So now your updates on the radio Monday and Kahnawake 911 on Thursday. So the information is still going to be spread out, I think, to meet our needs. So with that, we'd like to thank you for taking the time today. Have yourselves a good weekend. Be safe, and we'll see you next time. On behalf of all of us, Onerahtohkó, Onegiwahi.